So our first speaker this morning um, is the co-founder and policy lead of HealthEnabled, which actually facilitates the measure of the Global Digital Health Index. So please welcome Dr. Patricia Michelle.
Okay, wonderful. Thank you so much, Portia. It's great to see you, and Alvin and Jai and everyone. What a wonderful gathering. And I feel so honored and privileged to be speaking today about the Global Digital Health Index and maturity model. I've had the wonderful privilege of working with and alongside many of you for many, many years, including, I think I interviewed Alvin in, I want to say, 2004 about the mobile telemedicine project that he was leading in the Philippines as part of my PhD research when I was doing my PhD on mobile phones and health in the way back machine. So really thrilled to be here with you all today. So today I'm going to share a little bit about the Global Digital Health Index and some of the work that we've been doing. But before I do that, just wanted to share HealthEnabled's mission, which is really to improve health outcomes and strengthen health systems through digital transformation. And a lot of the work that we do is related to working with governments and large implementing organizations to develop strategies and policies that can support the enabling environment for digital health. And we also have a new focus on the professionalization of digital health to help increase the capacity at all levels of the health system. And so one of the big initiatives that HealthEnabled serves as the lead technical partner for is the Global Digital Health Index. And I'm really thrilled that we work in very close collaboration with AHIN in the region to support countries that are interested in participating in the Global Digital Health Index, many of which are represented today. And so one of the things that we know is that which is measured gets done. And so I feel like I'm sitting in a room with a lot of data people who can know and appreciate this. And so when we set out to develop a digital health index and a maturity model, it was with this view that if countries were able to measure where they were and then track their progress over time in a standardized and systematic way, that it would empower countries to know what areas they needed to focus on, would enable countries to compare themselves to other countries and learn from each other, and then would also serve to motivate countries to make very targeted investments in specific areas to help increase the overall maturity within their countries. And so we had paused the Global Digital Health Index at the start of the COVID-19 pandemic because a lot of ministries of health were busy doing other things other than measuring their digital health maturity. And prior to the pandemic, we had 25 countries that had participated in the index. And then as the pandemic was starting to get under control, we took a bit of a step back and decided that it was a good time to assess and review the index to evaluate whether or not it was still relevant, that the indicator still made sense. There were a number of major developments that had happened since the development of the initial set of indicators, as well as the platform. And we wanted to take a moment to review that and take those considerations in, as well as, a global pandemic happened. And there was a lot of active engagement in using digital technology as part of the COVID-19 response. And for many countries, especially low and middle income countries, it was one of the first experiences that a lot of countries had in scaling digital health solutions nationally. And so it's a very interesting moment, I think, in the history of digital transformation in health to recognize that now there is this new muscle memory that a lot of countries, a new experience that a lot of countries have, and real motivation across countries to more systematically embrace digital technology within the health sector. And so the overall Global Digital Health Index approach, it's an open data platform. It is free and accessible to all users. It uses a core set of indicators for measuring progress against the 7 categories of the WHO ITU e-health strategy framework, which is the framework that a lot of countries have used to design and develop their national e-health and digital health strategies. And so really this tool is meant to be used as a monitoring tool alongside and a planning tool alongside the development of national strategies and policies. And so it includes a world map, country-specific displays, country-specific pages, as well as a benchmarking tool and the capability to generate country scorecards. And so, as I mentioned, there are 25 countries that have been engaged in version 1. We published a State of Digital Health report in 2019 with an analysis of the countries that were in the index, and then including a regional analysis. And I think what's interesting to show here is just the strength and the leadership of the Asia region in comparison to some of the other regions that across the board, Asia is either on par or ahead of the game in terms of maturity when compared to other regions across the 7 ITU WHO components. And so AHIN has been leading the regional review and redesign process and conducted an indicator by indicator review that was led by Aaliyah and Jay. And Aaliyah will be presenting the results of these reviews, but just wanted to share that, for a lot of the countries, the sort of high level overview, that they were able to work their way through the index in somewhere between 84 minutes or 52 minutes and 120 minutes. And for some countries, it was the second time that they had done it. So they were one of the original participating countries and they engaged in the re-review. And we think as more countries progress, that it'll be easier and easier for countries to update their data and review and track their progress over time. And what they found in the process was that most countries have made progress across the board since they participated the first time around in 2018. Countries are validating their data, and the assessments that were conducted have informed the rewording of indicators to really make them clearer, as well as contextualization of the indicators. And so we also engaged in a very active virtual regional workshop. And I have to commend my colleagues at AHIN for really bringing together a fantastic group. I mean, many of you are probably sitting in the room right now, so I just want to, give a shout out to all of you for participating in the virtual regional workshop that we had, where we reviewed the design and the way that the Global Digital Health Index functions, and solicited recommendations for how we could improve things like the data capture the data visualization. And this was all validated in a global workshop. And the results of all of this are available for anybody that would like to see them. We have more recently been sharing them to solicit peer-reviewed feedback through the various digital health listservs and networks. And so what came out of the version 2.0 review and redesign is that we've now increased the indicators from 19 to 23. We've removed 9 sub-indicators, but we've added in 7 new sub-indicators. So in the end, I think we're 1 indicator difference from the original set of indicators and the new and improved set of indicators. And the alignment of the indicators was really to align with the WHO digital health strategy, which did not exist at the time that the GDHI was first developed, as well as an increased focus by countries on universal health coverage, which is the theme of this conference and this meeting. The new indicators also address emerging technologies and interest in digital transformation, and the effects of a broader digital transformation on health specifically. It incorporates private sector engagement, and it better helps us to measure diversity, equity, inclusion, and human rights in digital health, including things like the gender digital divide, which we know is increasing and puts digital health programs at risk of not meeting the needs of the populations that they are trying to serve. No core indicators were removed because it was deemed that they were all still relevant. And even as we tested them across countries, there was still a lot of interest in maintaining the core indicators. What this means as well is that countries that have already participated can now use their initial data and then measure progress over time. And so some of the updates in terms of the data collection workflow is to increase the opportunities for data to be put into the GDHI. Originally, the initial design of the index really focused on ministries of health putting in the data, and now we are aiming to open this up beyond ministries of health to the communities, digital health communities and partners to help pre-populate the data, but engage with ministries of health to validate the data and provide their review and their confirmation of the data. And data, what has been recommended is that we publish data as both unvalidated and validated data. And this is something that we're now planning for in the next version of the Global Digital Health Index, because the index is only as good as the information that is in it and the availability of data for countries to be able to measure their own progress, but then also compare themselves to other countries and do the benchmarking. There have been a number of proposed updates to the user interface, including a change in the overall color scheme of the GDHI, as well as revised screen designs for existing data visualization pages. So we'll be improving both the existing pages that are in the GDHI with additional types of data visualizations, including spider graphs and bar graphs, but also we'll be adding a regional page so that regions are able to do regional comparisons, as well as functionality for subnational data, particularly for countries that are federated, but also for countries that are interested and much more actively engaging at the subnational level. And so I think it's going to be a really important development. We've been working with Nigeria, which has implemented the GDHI across 10 states with the support of the Bill and Melinda Gates Foundation. And we're now in discussions with India around doing the same thing or something similar in India. And so we'll also be improving and introducing some new features to better support country comparison and display data that comes from multiple sources outside of simply data that is directly provided by governments. And so some of the next steps that we are working our way through, we are now developing and costing the specification for the version 2.0. We are working with countries to test the new indicators that are that have now been peer reviewed. We are working with Gavi, the Vaccine Alliance, and they are using the GDHI with countries to prioritize enablers as part of their digital health information for immunization roadmaps and their health system strengthening grants. Global Fund is planning to use the GDHI to set a baseline for their new strategy and then engaging year on year for countries to support annual reporting. And we'll be doing a validation workshop at the Global Digital Health Forum in Washington, D.C. So look forward to seeing some of you there. And we anticipate the Global Digital Health Index version 2.0 in mid-2023 and invite new countries to engage to set a baseline from now in anticipation of the launch of the new version 2 of the index. And so I will pause there, and I believe there are some questions in the chat. I believe that slides will be made available. I'm happy to have my slides made available. That is not a problem. And yeah, and I'm happy to facilitate an intro to some of the colleagues in India that are working on the GDHI in India.
Portia,
Yes.
one question here.
Okay, please.
Patty, just quick
Yeah.
question. How often, this is Alvin, how often do countries have to update their GDHI data? What's your recommendation?
So ideally, we'd like for countries to do year on year. I think it would benefit them to do it year on year. What we found is that for the countries that the first time a country engages with the index takes a little bit longer because they have to understand each indicator, understand what the different phases are. And even with that, I think, oftentimes, we've seen it done for the most part in less than 2 hours. Like it's not a heavy lift, and it was purposefully designed not to be a heavy lift. Like someone with a decent knowledge of digital health in the country could probably do it. We prefer that it's done in groups so that there's like more of a consensus around the phased selections. But you also have to provide kind of justification for each of the phases that are selected. So it's very difficult for a country to pick something, to pick a phase and not, without having the backing. And what we've seen is that countries will often undervalue themselves. And then when we go back and we check their justification, they're actually more mature than what they've selected in their index selection.
Thanks, Patty.
Thank you, Patty. We'll hear from you. So we will continue to collect comments and questions and share them with you, and hopefully you can also respond. So everybody, a round of applause for Patty Michelle and HealthEnabled. And we do enjoin you to use and be familiar with the Global Digital Health Index.